Let's talk a little history, if we could. And what do you know about the Spanish flu of 1918? And have you looked at that pandemic and noticed and compared and noticed the similarities, and not just in how the virus then affected people, but how people reacted to things as simple as wearing a mask?
No, that is actually a very excellent observation. It is amazing how 100 years later, human beings haven't changed in how they react when they are faced with prolonged constraints on them. And there are pockets of people that rebel very dramatically. There are pockets of people that continue to feel like there are that it's not real, or that it's not as bad as people say. I will say the two fundamental differences between this and the Spanish flu, not from a medical standpoint, but from a social standpoint, and from a care standpoint. So number one is, obviously, in 100 years, medicine has improved.
Right.
And if the Spanish flu, if the exact same thing happened in 2020 that happened in 1918, the number of people that died, which again was 50 million, it was reported as 50 million people around the world, would have been much less. And that's simply because healthcare does a better job. However, when you look at people's responses, they continue to. There were pockets that rail against masks and, things like that. So the other main difference is also related to technology, and that's social media.
Right.
And the spread of information, which is sometimes accurate and sometimes not. However, the not information takes hold and can spread and has the opportunity to spread so much further, and therefore, I believe, and again, I wasn't around in 1918, but I believe that the agitation related to that is probably so much more.
The other part that I found very interesting is the difference today. We have President Trump clearly acknowledging that this is a virus that, and again, he's kind of, I don't want to say flip-flop, but he's changed his tune and then gone back and then changed his tune again. But he has acknowledged it and still does the daily briefings. But back then, President Woodrow Wilson never made a single public statement during the entire outbreak, and would end up later on catching it himself, I believe.
No, and yes, he did, and recovered from it, obviously. Mm-hmm. But you're right. I think that is to a certain extent, that's the personality of the two presidents. That also goes to the fact that we have that our presidents now, starting actually with FDR with his fireside chats, use media to promote communication. And so that's all part of history. Whether it's FDR or whether it's Kennedy using a TV, and now it's our current president using Twitter and those types of things. You use the tools that are available. And you can find these on just by Googling them, but you can find a lot of mask-related materials, whether it be from newspapers or ads or that sort of thing, cartoons, political cartoons, referencing masks, and the same argument over masks was being had in 1918 that we're having today. It's really back to your original point, how after 100 years, how much we haven't changed as human beings. Yeah, we are fiercely, and I will say, what I don't know, and I admit that there's a lot that I don't know, but what I don't know is how other countries responded, whether they, say, the countries in the Asia-Pacific area, did their cultures, allow or promote mask wearing, and the population as a whole did or not. I'm not sure about that, but certainly in America we are fiercely fiercely independent,
Yeah.
and feel that anything that is mandated to us, even if it's in our best interest or in our country's best interest, we tend to rail against it a little bit until and unless there is overwhelming and consistent, to your point, and consistent messaging that says, no, this is really good for you, and this is really good for everybody else.
Yep.